This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222.
Which is better for me if I have unexplained infertility, IUI or IVF?
Okay, so the question is, for unexplained infertility, IUI or IVF? I have this discussion quite regularly, and I'm a conservative guy. I believe IVF is the end of the road of fertility treatment, whereas some of my colleagues believe it's the standard treatment when you walk in the door. And I think they overuse IVF in that regard. So in unexplained infertility, IUI is a reasonable option. It's less invasive, less expensive. And although the pregnancy rates are less, you may well achieve a pregnancy in that scenario. When do we use IUI? I generally use it in couples with a year to 2 years of trying, get to unexplained infertility until you get to 12 months, that's the definition. And we've excluded all other possible causes, good sperm, good fallopian tubes, good ovulation. And then that's unexplained infertility. She gets 12 months without getting pregnant. The role of IUI is to improve background pregnancy rate. So we know statistically that after 12 months of trying in unexplained cases, the odds of a pregnancy per cycle has dropped from 15 to 20% when you first started trying to something like 4 or 5% per cycle by 12 months. Probably because there are some other causes that we don't understand, and the women who are going to get pregnant easily have already got pregnant. Once we get beyond 12 months, we do have a problem. We're concerned that we do have a problem, but we don't necessarily know what it is. So what we're doing with IUI, the concept of why it might be successful, and in a couple who've been trying for 12 months and we do our first cycle of IUI, the pregnancy rate has jumped from that 4 or 5% I talked about to more like 15 to 20% again. So it's a substantial jump. The jump is we believe it's because we're getting good sperm because we process the sperm and select a small volume of the very best sperm, and it's in the right place. We actually put it inside the uterus. So it's halfway towards the fallopian tube where the egg's waiting. And thirdly, we've been watching the cycle so we know which day the woman is releasing her egg. And it's on that day that we put the sperm inside the uterus. So we're optimizing everything that nature ought to be doing. And we believe that's why we get success. So the 15 to 20% in the first cycle, the second cycle of IUI is not too much different from that, but by the third cycle of IUI, the odds appear to have dropped to more like 12% rather than the 15 to 20%. That's the point at which I would probably move people on to doing the IVF treatment. If people would say that's all well and good and you're going to we've got 2 cycles and we've got 30% of the patients pregnant, they haven't needed to go through IVF. But the disadvantage is that compared with IVF, that in one cycle of treatment, you're actually significantly better doing an IVF cycle. So with an IVF cycle in women under 38, the success rate is going to be in the order of 35 to 40%. So you can see that's substantially more than an IUI cycle, but it is more expensive, something like 3 or 4 times more expensive. It is invasive. You've got to have a big procedure to collect an egg, which has complications, albeit rare, but there are complications. And psychologically, it's more demanding than an IUI cycle. More visits to the clinic in the monitoring phase. And it is a trade-off, IUI versus IVF. Under 38, I've certainly, explained it because of a relatively short duration. Somebody who's been trying for 4 years and we can't find any reason why. The evidence is that IUI does not work particularly well, that they should have got pregnant in the meantime. Over 38, IVF starts to edge ahead because the IUI rate starts to drop off. And certainly over the age of 40, IUI really has no difference in the unexplained infertility compared with natural intercourse that's well timed. And that's where IVF probably should be the first step rather than either waiting or going to the IUI route. Depends on your age a little bit as to which you would choose, but certainly in younger patients, I certainly recommend for the majority of patients, first step is IUI. I do explain those just as I have now, and many patients will take the view that they want to get pregnant as soon as possible and therefore they will go down the IVF route. But it's certainly not necessary as the first step, which unfortunately many of my colleagues seem to believe.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.